through a difficult time together. This is from me, Dr. Jason Tripp, and the staff at Tripp Chiropractic. Today I want to take you to the CDC website, and it gives some pretty valuable information, so I just want you to take a look here. This is right on the CDC website. It's under how to protect yourself, and I think that's important to know, is how to protect yourself as you're going through. Number one is, don't be in a panic. There's very easy ways of containing and controlling this and protecting yourself. So let's go through some of what they are so you can relax and feel better as you go. This is straight from the CDC. It says, know how it spreads. There's currently not a vaccine for this, so mainly the best thing to do is prevent being exposed to it. Now, some people have just closed the door, shut themselves off, they're not coming out of the house, those kind of things. That's not what this says, and I want you to go along with me on this. The virus is, we know it spreads person to person in close contact, usually within 6 feet, and it's respiratory droplets. So somebody coughs or sneezes, and the droplets can land on mouth or nose of somebody nearby, and you can inhale it into your lungs. So that's how it spreads. However, just if you take precautions, so washing your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose or coughing or sneezing. So if soap and water are not readily available, then use hand sanitizer. No, you don't need to go buy every single one on the shelf at Walmart to empty out the whole place just to have enough sanitizer. Listen, don't be in a panic. Realize soap and water, you're going to cleanse, and if not, you can use a hand sanitizer. Most of us have some laying around the house anyway. This is stuff you guys have done since you were children. You wash your hands, right? Cover all your surfaces of your hands, rub them together until they feel good and dry, it says. Avoid touching your eyes, mouth, and nose. And that might be something that you're not used to doing. If you have an itch in your eye or something, you just kind of reach up and do that. But if you have unwashed hands, you could have to avoid that. Once you've washed your hands, you've used the hand sanitizer and let it dry so that there's nothing you're going to be getting into your eye that's not supposed to be there. Notice they're not saying never touch. It says avoid touching your eyes, nose, mouth with unwashed hands. So again, don't go into a panic and think it means all the time, anytime, ever. Next is avoid close contact. Avoid close contact with people who are sick is actually what it says. So it doesn't say you can't be near people if they're not sick. Now, how do you know who's sick? How do you know who's not? And a lot of people have just gone into panic mode, and so they're distancing themselves from everyone. They do say to put distance between yourself if we'll call it coronavirus, if the coronavirus is spreading in your community. So, how many people are actually sick in our community right now? And so if you're looking at that, how much distance do we need to put? Well, how many people are actually getting sick? Or is this a hot spot for the sickness? Then you don't need to be panicked if somebody was walking up close to you or if you happen to pass somebody on the street. So again, just trying to help people to feel more relaxed, more at ease, and not be in a panic. This is straight off of the CDC website, right? So they're saying if the virus is spreading in your community, then you need to be very careful, not be around people. Now, take steps to protect others. If you feel sick, if you feel like you're not doing well, then you need to stay home. Don't come out and cough on somebody else or sneeze on somebody else if you're not doing well. That's why we made it mandatory in our office that if our staff are feeling sick, that they stay home, required. Now, if you do have to cough or sneeze, it doesn't automatically mean that you have the coronavirus. So, don't look at everyone. If somebody coughs or sneezes, don't look at them and think, oh, now that I'm going to have the disease, or now I'm going to have the problem because they sneezed on me. Sometimes it's just a cough or a sneeze. But when you do cough or sneeze, make sure you use a tissue. This is, again, things we were taught in kindergarten. So throwaways, use tissues. Don't hang on to those things. Immediately wash your hands in soap and water. And listen, it says for at least 20 seconds. If soap and water are not readily available, clean your hands with hand sanitizer. We just talked about that, with at least 60% alcohol. If you're at my office, we have this. We have the soap, we have the water, what have you, but we also have the sanitizer. You have your choice, or use both. Double up if it makes you feel better. Now, interestingly, this says wear a face mask if you are sick. It doesn't say wear a face mask no matter who you are. So a lot of people are wearing it just out of precaution. But even from the CDC, what they're saying is you should wear a face mask when you're around other people if you are already sick and you don't want to spread that to them. So if you're going to a medical appointment, for example, well, then wear a face mask so that you can keep covered and you don't spread it to anybody else. It says if you're not sick, you do not need to wear a face mask. I'm reading this right from their site. Unless you're caring for someone who's sick. Now, if you're around someone who is sick, then you need to go ahead and wear the face mask. It protects them. Face masks may be in short supply, so you should be saving those for caregivers. That's why, again, don't run out and buy all of them off the shelf. Other people who are actually working with elderly or people who are sick would need to have some of those as well. And then one of the other things that we did in our office was made sure we cleaned and disinfected everything, and we're doing it every day, whether that's tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, like every surface that you can possibly think of. Make sure and disinfect, clean them, make sure everything's clean. Again, this is things we do anyway, right? We clean our houses, we clean the surfaces, we make sure that we're taking care of things. So I want to just kind of give you these tips and hints. If you are going to disinfect, they give you a diluting of household bleach that you can use on how to clean properly. Alcohol solutions, at least 70%. There's a lot of different variations as to what. But again, right from the CDC, you can go over here and take a look of how to protect yourself. The main thing I want to help everybody understand is to not be in a panic. Don't let your anxiety get the best of you. This is a flu, and we're going to get through it together. So if you need anything, again, this Dr. Jason Tripp, I'd be glad to help you. You can give the office a call at 724-342-2225. We'll be glad to get you any updates, anything that we can to help you out. I'll talk to you soon.